Ever get tired of just feeling the tension in your neck? Majority of my patients that come to see me with neck pain all think the same thing. They think that all their neck problems are coming because of their muscles. So they've been to the massage therapist. They've taken the muscle relaxers. They've done every stretch that's available on YouTube, and they still got the same problem. Well, let me tell you, today I'm going to give you another way to look at your neck pain and to help find the underlying cause of your neck pain. And I'm going to tell you, today we're going to take a neurologic approach. And what do I mean by neurologic? I mean your brain and your nervous system. Because the brain and the nervous system drive and control the muscles. So sometimes it's not a problem with the muscle, it's a problem with the brain or the nerve. And so today, let's look at the first thing, the most common part of your brain that can cause you to have neck pain, and that is your cerebellum. The cerebellum, also called the little brain, is here in the back of your head. Two lobes right here at the occiput, or the back of the skull, and these things control what we call ABCs. ABCs are accuracy, balance, and coordination. So the cerebellum coordinates all movements, okay? And so guess what? It's in control of muscles, and in particular, posture muscles. So posture muscles are unconscious. That means that you don't think about them to make them work. They work unconsciously, controlled by the cerebellum. And the number one thing about muscles and posture muscles is tone. So we're going to look at the difference in tone. Let me show you what I mean. If the posture muscles have lost tone in your neck, your head will tend to drift forward and your shoulders will begin to round. Now, if your neck has begun to have hypertonic tone, then your shoulders will begin to feel like they're up around your ears because this is so tight. Neither one of those are good, and both of those can contribute to neck pain. So what do we got to do? We got to find out, is your cerebellum regulating your posture muscles with the right tone? Or do you have irritation to nerves or weak nerves in your neck that are causing your muscles to change? And I'll say this, if you go down and you get your massage and by the time you get home you're already tight again, it's not your muscles. Something else is going on. The second possibility is, if it's not the cerebellum, it could be the frontal lobe. Now, what does the frontal lobe have to do with neck pain? Well, the frontal lobe controls voluntary movements of muscles. Okay, but it also does one other very important thing regarding muscles, and that is inhibit flexor muscles. So flexor muscles in the upper part of our body are in the front. So what happens is, if we begin to lose our frontal lobe function, then we lose inhibition of posture muscles, flexor muscles in the front. So what happens is these muscles begin to tighten up and our head begins to drift forward. That happens because the SCM muscle, the anterior scalenus muscle, get too tight, too toned, and they pull our head forward. If your head moves forward even 1 inch, it's like putting an additional 10 pounds of weight down on your head. Big problem. Last thing is your autonomic nervous system. So your autonomic nervous system is your balance between sympathetic, which is fight or flight, and parasympathetic, which is your rest and digest. So you can imagine now, if I get into a sympathetic fight or flight, I'm going to have an increased tone, muscle tone, in particular flexor tone again. So this tension in the front of the neck can be caused from either a weakened frontal lobe or a sympathetic dominant autonomic nervous system. Now, let me give you a couple solutions, guys. Number one, you got to know if your cerebellum is imbalanced or if it's under functioning. Okay, and so for that, you need to be checking out things we just talked about. Balance. There's a test called Romberg's where you put your feet together and you close your eyes. And if you're seeing and feeling swaying going on, you probably have a cerebellum imbalance. Then there's another test called finger to nose. Same thing. Put the Rombergs, bring your arms out front, take your little pinky finger, bring your pinky finger right in, straight into the tip of the nose. If you're missing or if this is shaky, you probably have a cerebellum problem. Compare side to side. Have somebody watch you do this. And then lastly, you might look at something that we would look at with eye movements. Like if you get pulled over by an officer and he suspects you've been drinking alcohol, because alcohol affects the cerebellum, he's going to have you do eye movements. He's going to have you follow his finger with your eyes to see if those movements are smooth or are they choppy and bouncing. Those can tell you if you have a bad cerebellum. And then what about your frontal lobe? Well, posture is huge. If you're starting to have trouble recalling words or producing words, if you're starting to have trouble with your working memory, you start getting forgetful and things like that, that's definitely a sign we need to look into your frontal lobe. And then lastly, your autonomic nervous system. How's your sleep? How's your digestion? If you're having trouble with digestion, you have trouble sleeping, you're having constipation issues, it could be because you're getting a sympathetic dominance. And that can be checked out by something we do in our office. We use a pulse ox machine to look at your oxygen, your heart rate, and your tissue perfusion to see if you're developing a sympathetic dominance. So all of these things can be tested for. All of these things can be rehabilitated to help you get rid of your neck pain. So until I see you next time, I hope you get a handle on this. Hope your neck pain starts to improve. And I hope most of all, you live life well. God bless you. See you next time.